Hello friends, welcome to Expert Medical Coding. In today's video, we are going to learn about ICD-10 CM updates 2023 third quarter part 3. In this video, we are going to cover two coding clinics. They are, the first one is, what is the root operation for JADA system which utilizes vacuum suction to control postpartum hemorrhage. And the another one is, what is the ICD-10 PCS code for insertion of a tracheostomy tube into the esophagus due to tracheal agenesis. So let's get started with the first one. That is, what is the root operation for JADA system which utilizes vacuum suction to control postpartum hemorrhage? And the question is, the patient suffered obstetrical lacerations during delivery which required repair and packing. Following the delivery, the provider documented lower uterine segment atony and continued bleeding despite the previous repairs. So, the patient is having lower uterine segment atony. Let us see what it is. Uterine atony refers to the failure of the uterus to contract sufficiently during and after the childbirth. With uterine atony, however, the uterine muscles do not contract as needed, putting the individual at high risk for postpartum hemorrhage. So now in this scenario, the patient is having obstetrical laceration during delivery which required repair and packing, and following the delivery, the provider documented as lower uterine segment atony and continued bleeding despite the previous repairs. Now the JADA system loop was placed transvaginally into the lower uterine segment. The cervical seal was inflated with saline and the vacuum suction source was turned on. The ICD-10 PCS index under the term suction instructs to see the root operation drainage. So when you go and search for suction, it will lead you to the drainage root operation. However, the objective of the procedure is to stop the bleeding. Here in this scenario, the objective is to stop the bleeding. So what is the appropriate root operation for placement of the JADA system which utilizes vacuum suction to contract the uterus in order to control the postpartum hemorrhage? The answer to this question is, we have to take the control root operations because the objective was to control the bleeding, not the drainage. So assign the code 0W3R7ZZ, control of bleeding in genitourinary tract via natural or artificial opening for control of the postpartum hemorrhage. Now let us see this in the PCS table. 0W3 and the body part is genitourinary tract and approach is via natural artificial opening because the JADA system was inserted transvaginally, and device is no device and qualifier is no qualifier. The objective was to control bleeding by means of uterine contraction. The JADA system provides gentle suction that contracts, collapses the uterus, thus compressing the blood vessels, which stops the bleeding. Although the device may also assist in draining any accumulated blood, the objective was not to drain the uterine cavity, but rather to stop the bleeding. Thus, the root operation drainage is not appropriate, and the correct root operation is the control. Now moving toward the next boarding clinic, and the scenario is a newborn with congenital tracheal agenesis. Tracheal agenesis means absence of formation of trachea, developed upper airway obstruction. The baby could not be intubated in the NICU and an emergency tracheostomy was performed. During surgery, dissection continued down onto the thyroid of tracheal rings. Instead of the trachea, a soft structure consistent with the esophagus was identified. A tracheostomy tube was then inserted into the esophagus and connected to the circuit, showing improved ventilation. Now the question is, what is the ICD-10 PCS code for insertion of a tracheostomy tube into the esophagus due to tracheal agenesis? In this scenario, the patient is having congenital problem, that is tracheal agenesis, that is absence of formation of trachea. For that, the physician inserted the tracheostomy tube into the esophagus. Now let us see the answer for it. We have to go to the index and search for insertion of device under that subterm esophagus, because the device was, that is the tracheal tube is inserted into the esophagus, and it will lead you to the code of 0DH5. Now we'll go to the ICD-10 PCS table and look for it, and that is 0DH5, and the approach is open here, and the device is other device. Because tracheostomy tube is not listed here, we have to take it as other device, and the qualifier is no qualifier. So the answer is 0DH50YZ, that is insertion of the other device into the esophagus, open approach for the tracheostomy tube placed into the esophagus. Please like, share and subscribe to Expert Medical Coding. Thanks for watching.